Thank you, Dr. Manish Singh Asad, and those participating in the session. Good evening, good afternoon, and good morning. This is the 2106th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. Upendra Kumar Verma. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We have so far uploaded more than 3,800 videos in YouTube. You can see the previous videos by searching Ifph Homeopathy. And the purpose of this forum is to take homeopathy to every home around the world. So what you have to do is just share the videos to your friends, whether it be a homeopathic doctor, homeopathic student, or homeopathic lover. It doesn't matter. You can take, thereby they will know what is happening around with homeopathy around the world. So uh, this is what I would like to say as an introduction. And let me come to today's guest. As you all know, Professor Dr. Upendra Kumar Verma has completed MD homeopathy, and he has special knowledge in German language from Max Muller Bhavan, New Delhi. Has a professional experience of 33 years of clinical experience and 29 years of teaching experience, and presently working as the principal and professor and HOD in the post of Graduate Department of Organon of Medicine and Principles of Homeopathic Philosophy at GD Memorial Homeopathic Medical College and Hospital, Ramakrishna Nagar, Patna, Bihar. And is a member of Board of Studies in Ifph University, and has presented nationally as well as internationally in different subjects. And very recently, in 2011, Dr. has present at Liga, the World Homeopathy Congress, and a paper at CCH Workshop, New Delhi. And present papers and several scientific conducted on ROTP at GDM Medical Homeopathy Medical College also. So I has presented so many sessions in our forum, and all the presentations were exemplarily brilliant one. And today we'll be talking about a different subject, the concept of pathology in relation to homeopathy. So what is the purpose of knowing pathology, and how importance is diagnosis, and from what to do with the diagnosis, and how we can move forward with diagnosis, and whether one can go a prescription but soon after the diagnosis. No, homeopathy is a different system. We have a different methodology of treatment. So we can proudly invite our guest of the day, Dr. Uh, Verma sir. Sir, please, you are the co-host now. You can begin the session. We welcome, sir. Please unmute yourself. Yes, please unmute. Yeah, co-host, sir.
Okay.
Okay,
Good
sir.
evening, everybody. I'm very much thankful to Dr. Ganesh Ji, who has given me opportunity today to discuss over the concept of pathology in relation to homeopathy. Since with the homeopath, we understand that what is the pathology, what is its utility, and how it helps us in the making the diagnosis of the disease so that prognosis can be told to the patient. So I shall first share my screen. Just
Yes, it's
yes.
visible, sir.
So
You can
this
make
is
it
my
full screen, sir.
okay. So concept of pathology in relation to homeopathy. So this is a point which I want to discuss among the physicians, especially homeopathic physicians. I know that everybody is well acquainted with those phenomena of the disease and disease in uh, body, the concept of vital force, the concept of vital principles, how vital principles get affected, like all those things. But today, especially, I am focusing, as I already told you, that of course pathology help us in the diagnosis of the patient, diagnosis of the disease, so that uh, we can forecast the fate of the disease, that how it can be treated, and whether it is treatable, whether it is a curable or non-curable disease. That is fine. But we homeopath very much particular towards the system, towards the disease, that how it appears, how it happens, what we understand about the disease, and what the modern science understand about the disease, that is to be compared and correlated with the disease. So my first slide, concept of pathology is basically materialist. Why I am saying this materialistics? Because unless and until they do not see anything, they are unable to say about anything that why disease has occurred. So most of the diseases, and especially related to acute diseases, so they want to find some etiology, that is some material like substance, some material which can cause a disease, that is either bacteria, virus, parasites, fungus, etc. So, and in every disease, whatsoever diseases, pathological condition is there, they want to search something material out of immaterial. Why I'm telling here immaterial? Because in homeopathy, we have the concept that disease is immaterial. Why I'm saying immaterial? Because the diseases is dynamic in nature, according to homeopathic point of view. Diseases cannot be material because if has it been material, then it would have been something different. But since it is a material, so it makes sick us through the dynamicity. So today I will not discuss those diseases which are actually acute in nature, and I will discuss only those diseases which are true chronic diseases, and which are having the nature of reversibility also. So especially the chronic diseases I will discuss. I will not discuss those diseases which are accidental, like road accident, drowning, burning, etc. Because while drowning, like it is a drowning, so before drowning, the man was not sick priorly. It was the condition. Now, if somebody has drowned in water, then what is to be done? It is not a sick condition. It is not a natural disease. It is something which has happened to accidentally, and after drowning has to be managed with taking out the body and give the pushes from the backside, so that the excess amount of water which are engulfed during the drowning is to be pushed out of the body, out of the stomach, so that he can or she can inhale. So such management is being taken and given. So it is not a sick condition. So our treatment is is not like that. Our treatment is something else. Similarly, if somebody is buried accidentally or immediately in the snow, like as the people go to the mountainers, and sometimes snowfall is there or snow sliding is there, and if a person is buried in that snow, so if I take out the body, so here the homeopathy is not applicable. Here one need to first rub and provide the heat artificially to the body, so that the circulation of blood which has been still, uh, which has slower down or which has lost its velocity or dynamicity blood circulation. So first we need to stable, we need to manage the circulation of the blood in the body, and then the body is to be rubbed and heat is to be provided. And after that, a cup of warm coffee is to be given so that there should be some stability. And after that, if there is some complication remains, then here the homeopathic medicines can be given after that condition, but not it happens sometimes that some of the doctors says that homeopath, if finds somebody is buried in snow, he will take out and start giving the medicines. So it is not like that. Homeopath doctors are not fool. They have studied a lot and they have studied all the phenomena of the diseases. So it is not like that. So he understand well that that is why I wanted to convey this thing today at from the slide that it is not like that, that the homeopath does not understand that what is the disease and how they will not start giving the medicine, but they have the all the idea of the management of different kind of the situations. So, in the homeopathy treatment plan, for the natural diseases, I am telling about the natural diseases. It is said that homeopath believes CZ effectus CZ causa. It means that according to the principle of homeopathy, if we seize the effect of the disease, then the cause will be seized itself. Suppose that a person is sick and showing some sign and symptom, and if those signs and symptoms are being treated through the homeopathic, and if those signs and symptoms vanishes with the help of homeopathic medicine, it means that the disease has also recovered, or the root cause of the disease is also recovered. Why I am saying this? That after noting the disease condition, after observing the sign and symptom, only then the pathological investigation are instituted or given or prescribed. Suppose a person is having pain in abdomen, then doctor thinks that an ultrasound is to be taken out so that he can understand that what is there in the abdomen. Or he may write on the suspicion of the renal calculi that X-ray is to be taken out. But he will not immediately refer that is a CT scan of brain is to be carried out. So there is a direct correlation between symptoms and the disease. So whatever symptom is exhibited naturally through our vital force on the surface of the body through abnormal sensation and feeling, those especially indicate that what part of the body is diseased or sick in condition. So concept of the treatment is to find immaterial cause in the disease. So a homeopath will not stick to find that let us see some blood test and etc. Of course, we make carried out blood so that we should know the amount. We should know like suppose I am telling about the hemoglobin. So I know I after examining we find that the patient is having less hemoglobin. But what amount, what extent hemoglobin, what up to what extent hemoglobin is down, that is not to be known by the naked eye. We can assess that yes, it is down, it might be 9 or 8, but what is the exact figure? That is to know the scientifically. So we should carry out the CBC or complete blood count so that hemoglobin can be assessed and should be known. So after assessing those hemoglobin, in the same manner, if somebody is having temperature, we understand that the body temperature is this, so the person is having fever. But if we utilize thermometer, then we will come to know that this much amount of temperature is there. And this definitely indicates us and guide us that what amount of rest is required to the patient. If it is 98, 99, then we will say that yes, you can continue your daily activity. But if the temperature is 102 degree or 103 degree, definitely we will have to be cautious and will tell that you should take bed rest immediately and you should not go out, you should not work. Likewise, that similarly in the cases of jaundice also, so we get investigated so that we can understand level of serum bilirubin, that what extent it has increased, whether it is a condition which is very much alarming, very much serious, or very mild. So pathology help us in understanding the disease condition in as a material. It accepts the effect of material, not the material itself. I am here writing this because in any disease, we cannot accept, we cannot say that the disease is, of course, immaterial. But we cannot think of anything immaterial without material. I'm truly telling that there should be some source of material source, then that material source, from that material source, immaterial influence is there, which is to be considered. Like I'm just saying that if, today the most of the homeopaths are here and they have joined, so they can understand that if there is a source, if there is a plant of Brania there, then Brania medicine can be taken. Then Brania medicine can be prepared. If had it been not the source of Brania plant, Brania could not have been prepared. Similarly, if arsenic alb is to be prepared, then source of materialistic source of arsenic should be there, so that from that arsenic, a medicine which is immaterial from the homeopathic point of view, like 200, 1 m, 10 m, so that is to be prepared, but source will be there. So source is in the distant level, but effect of that source is to be taken into the consideration in homeopathy system. So in homeopathy, that is why we consider that every disease is likewise that every disease is immaterial in homeopathic point of view. But we should also understand at the same time that if disease is immaterial, then there should be some materialistic source where from it has originated dynamically. I will come later on this point. So concept of pathology in relation to the disease and treatment. There, as I told you, that our plan of treatment is like CZ causa, CZ effectus, CZ causa. But from the pathology, from the modern science, it says that CZ causa, CZ effectus. It means that if there is some disease due to bacteria, then bacteria is to be killed by antibiotics. And if it is from the virus, then antiviral medicine is to be given. If it is due to fungus, antifungal medicine is to be given. And similarly for the parasite. So their concept is just to seize the cows, meaning by that after giving the medicine, the cows like bacteria, virus, fungus, parasite, etc., are being seized. So their effect will also be seized. Yes, it is true, but it depends on the materialistic point of view and concept of etiology, which they are understanding that this is the disease, is keep on changing. Why it keeps on changing? Because it depends upon the technology. Prior to the invention of the microscope, nobody was knowing that there are some bacteria or viruses, etc. But diseases were previously also prevailing. So diseases were prevailing, but cause was unknown. Why it was unknown? Because the technology was not that much advanced. Later on, while the finding from the concept of pathology, something material, so they came to know, like in the tuberculosis mycobacterium bacillus, about that this is the causative agent which affect the person and make the person sick in the cases of tuberculosis and other system also. So the concept of pathology and concept of etiology. So etiology is always changing type because etiology is based on the development of the equipment, development of the technology. So to see the material in disease with microscope or very fine as microscope or electronic microscope or so on. So they are always changing the concept. Suppose that they are first seeing the organ, then tissue, then cell, then other things. Just I am showing you. Treatment is based on etiology. Why? Because concept of etiology keeps on changing. It is dependent on advancement of the technology, and hence the concept of disease in relation to etiology changed from macro to micro and micro to other. And in the same way, in the examination of the patient or after the cadaver dissection is revealed, or in the autopsy it is revealed that how the organ is affected, then tissue is affected, they come to know, then say, why I'm saying this priorly, if somebody says that after a person died after a serious illness, then was find out that see, just liver was damaged, that is why this person was. So a gross organ was being observed because there was no any such technology to see the inside that what might have taken places. Later on, gradually, several autopsy and cadaver dissection revealed that yes, this person was died due to cross pathology, and somebody prior to that. So they came in the conclusion that it is the stages of changes. So first, organ is not damaged directly. Prior to that, tissue damaged, then the organ damage, then they came to know, no. Tissue is not itself responsible, but the cell is responsible for cell damage, then tissue, then organ. Later on, they came to know, so not only cell, but cell organelles first get disturbed, then cell, then tissue, then the organ. In the same manner, they are producing. So, concept etiology at the given point of time is always change, and that is never the final. So it is always changing. So just I'm showing a slide. Just see the stage 4. So I was telling that the first they look over this thing that the liver was grossly damaged. Then in some other body they found that no, there was progression of the scar in the tissue, and in some other body they found that the fibrosis was formed, and thereafter they saw that there are some scar tissue, and lastly finally they come to know uh, from anything, from autopsy or cadaver dissection, that how the healthy liver looks like. Likewise, that so in any given point of time, they they understand that this was the disease, but see the chronology. That first they used to see this because it was observable from the naked eyes. Then they came to know through the microscope or some other material that scar tissue is there, there is progression of scar, and the fibrosis, likewise that. So similarly, several such things like just healthy liver cells, how does it look? Then fatty liver, here changes were seen, and the fibrosis, it was observed that fibrosis first developed, then liver damage start, and then the cirrhosis. So these are the basic things. It is not the final, it is just a matter of understanding what I said, that it depends upon the concept of etiology, and etiology keep on changing because the technology is advancing, so they come to know at a given point of time different thing related to the single disease. So this is not the thing that I am just discarding these things, but just to make us understand, just make us to understand that how diseases are being known through the pathology, which is just a level. Now, finally, after organ, then tissue, then cell organelles, then what? Then they will come to know about the genetics. So genes are there. That is why it is genes may be affected priorly. So they are like that. So one after another, these things are being managed and categorized. So what the homeopathic understand about the diseases, because the pathology is always identified a given point of time, which is, and we understand the homeopath, the disease is a series of events. It is not a point that this is the cause of the disease. It is a series of the event which cause the disease. So in the series of event, we can see, and pathology can see at a given point that this is the disease, but actually that is not this. This is the product of disease at a given amount of a given point of time, and later on it will be something different. Now, priorly to that, it was something different. So it is always identify a at a given point that this is the disease. So and homeopathy believes that the dynamic influence of the barbific noxious agent, which makes us sick. First thing, not material, not bacteria, not virus, but what I'm saying, as I told you, some in remote there is source. I'm not telling that the bacteria, virus are not the culprit, not the thing which can cause the disease. But it is not exactly the bacteria, but the noxious influence, and or I can say the abnormality can produce by those things, those disease causing agent. These things dynamically derange our vital force and vital principle of our living body. The vital principle, the vital force, which is autocracy in its nature, meaning by it is self-sufficient to recover the patient, to improve the patient, and make the person healthy. So, having its absolute power, retaining all the parts of the organism in admirable and harmonious and vital operation as regard to both sensation and functions. So, our vital force is dynamic in nature, and with it dynamic influence of the noxious agent, then these are effect dynamically to our body, vital force, and when vital force get some trouble, some disturbance in their flow, on the harmonious flow, then it tries to maintain normal health, because it is official duty. I'll say yes, it is official duty of the vital force to keep our body healthy. So by doing this, we are made sick, we are exposed several times with the surroundings, bacteria and viruses. But we are not made sick, because the sick condition can be attained only conditional. Disease is conditional. I'm not teaching those phenomena, all those phenomena, because it will take longer time. So I am just focusing over the concept of pathology, and pathology is based on etiology, and etiology keep on changing because the technology is being changed time to time. And similarly, in the homeopathy, the concept is that our vital force get deranged, only then sickness can be there. And why vital force get deranged? Because due to noxious agent. And noxious agent can be brought to be normal without knowing ourselves by through the vital. But sometimes it happens that the influence of dynamic morphic noxious agent is so stronger that the vital force of our body is not able is not in a position to control these things within the normal limit. So it produces some abnormal sign and symptom, some abnormal sensation and function, so that people, a doctor, can understand that the person is sick, and then the person start feeling some abnormal uh, sensation, abnormal feeling, and then it is the indicative for the doctor himself. So since since it is dynamic in nature, hence it get affected by the dynamic morbific noxious agent, but it's official duty to keep our health protected. But when the dynamic influence of noxious agent is more powerful than the vital force, then it represent its unhealthy condition through abnormal vital function and abnormal sensation. So this is the phenomena of the disease. Homeopath understand that this is the way how the persons get unhealthy. So in I will tell you the searching pathological material. Now, if someone tries to find pathological condition on this system, suppose our vital force get drained due to abnormal oxygen, and we started feeling some abnormal feeling, abnormal sensation. But at this stage, just one day has passed. If some pathological investigation is to be taken out, like blood examination, X-ray or USG, we will not find anything because it has not reached to up to that level, so it can seen abnormality at the tissue or cellular level or the organic level. As I told you that the disease is dynamic in nature, hence nothing material can be traced at this stage from the pathology point of view. But if the chain of dynamicity of the disease not controlled or not stopped, then it continues to progress, and now it chooses itself where to represent the disease. Yes, it is not like that any disease can affect any, but I understand and we understand that the everything require some condition to grow. So bacteria, especially bacteria, different types of bacteria, the science has come to know that if it is a mycobacterium, then it will produce from the lungs tuberculosis. If it is a staphylococcus, then it will affect the tonsils. These things categorization has been taken from the microscopic, from the point of view etiology. Yes, we understand. But why it has happened, why the tonsillitis has occurred, why the tuberculosis has occurred. For that question, for that thing, we know that there is some past history, there is some family history, there is some diathesis due to which the disease has started and disease is progressing. So here, the derangement of the vital force, if it is not capable to self-repair, then it produces some abnormal signs symptom, or if it affects some organ. So this organ choice is itself, it decide by the vital force on the basis of the family history, diathesis, and the past history of the patient. Accordingly, disease is planned and disease is structured. So we understand that if somebody has in family history this disease, then this person or the patient who has come to the chamber might have this, and with the help of the past. So in homeopathy, it is very much essential to know the past history of the patient as well as the family history of the patient, so that we can understand that how to remove it in the disease condition from the patient and how to make the patient healthy. But if the chain of dynamicity disease is not controlled or stopped, it continues to progress. And now it chooses itself where to represent disease pathological condition. Here onward, the pathological finding is traceable, but it is not the disease itself, but it is the product of. So when it has progressed to a great extent, then it is up to that level that the dynamicity is not stopped. The sick condition is chain is going on. Then it affects some tissues, some cell, and then it represent. Then we can find that yes, there is changes in the blood chemistry. There is some changes in the pathological condition, a pathological condition in the sense of the structure of the organ or the covering of the organ or at the tissue level or at the cellular level. But here also, if we find some traceable pathological condition, that is etiology, but it is not the correct thing which is to be treated right now, because it is to be, if it is treated, so you are treating and somebody is treating, it is the product of the disease. So disease has started. Conception is the priorly very early, and now it is a chain. It is going on, and at the given point of time, just we are examining, and we are saying, yes, this is the disease. This is to be treated. So that is to be treated, and that is treated with the help of so many medicines like antiviral, antibacterial, or there are some medicines which are steroids, etc. But since the disease root cause has not been considered, hence it reappears again and again in the stages of the chronic disease, in the case of the chronic diseases. So treatment based on etiology, causative factors. So treatment cannot be advised. There is no, if etiology is not able. Very good. So the modern system or the pathology is unable to treat the diseases where there is no etiological finding is there. If there is, I'll say, if there is no, if there is temperature, if a body is, if an individual person, if his normal body temperature is to be 96.5, if somebody is having 97, it is variable. It is not exactly 98.4 is the normal temperature body. No, it is not like that. Somebody is having 97, somebody is 97.5, and if somebody is having 98, so that person whose normal body temperature is 96.5 or 97, and if he is having 98, then he is feverish. He will not feel well all the time. And here, the modern system failed to treat such diseases, such types of several diseases. There are several diseases which cannot be, there are several not diseases, fever condition. If it is up to 99 degree Fahrenheit, then it is not sumo or paracetamol or whatsoever the medicine, the aspirin, etc., is not advised to be given. Why? Because they will give only if it is raises after 100 degree Fahrenheit. But there are several persons are left untreated who are suffering with the low temperature. And there are sometimes it also happens that there is no etiology and sometimes unknown causes of paresthesia, unknown causes of pyrexia. There is no cause at all, but there is no treatment and patient is left to suffer with the 99 temperature or 98.98.8 degree Fahrenheit temperature without any medication, and they are exhausted daily. In any case, there is no tuberculosis, no other thing, but there is feverish. So several such intermittent diseases, several such types of fever, several such type of symptoms which the patient is having without any pathological condition, homeopathy is the best solution for such disease. So this is the point where I want to focus over, that if etiology is unknown, so they have categorized, okay, this is the bacterial, this is the viral diseases, and if some diseases, that slide will be shown later on, that some disease where etiology is not known, then they will categorize that it is the idiopathic disease. So such idiopathic diseases is very easily treatable in homeopathic system of medicine because it not depends on the pathological finding, but it depends on the sign and symptom. Similarly, there are several such diseases which always demand attention, like autoimmune disorder. Now, if there is some known etiological condition that is treatable, and there is some disease where etiology is not known, that is idiopathic. And if there are some more diseases, they are considered as the autoimmune disorders like HLA-B27, several other diseases that like psoriasis, etc. There are so many diseases. They understand from the pathology point of view that this is the cell which has started damaging itself inside the body. So likewise that, and they say that nothing can happen, and so they are being given steroid and they improves. But sooner, after 1 month, 2 months, 3 months, again those symptoms appears with a larger amount of destruction. So idiopathic, and then idiopathy, then they come to know autoimmune disorder, and if after that they categorize diseases with the lifestyle disorder. So there are several conditions can be treated through homeopathy if, because I understand and I know, and most of you will agree that no diseases can be treated uh, with allopathic system of medicine or modern system. If it is truly clinical diseases or truly chronic diseases, even eczema cannot be treated. Even eczema can be palliated, can be suppressed, but it cannot be made cured. It is given steroids. Patient may think that he is now recovered, but what is happened, on what cost they have recovered, they are not able to understand. On the cost of their lungs infection, or I'll say that on the cost of the bronchial asthma, at the cost of lungs, they have benefited through the eczema, or I'll say that on the cost of their joint pain, rheumatoid arthritis, etc., they have recovered from their problems. So the allopathic medicine are introduced with and withdrawn. Why I am saying that it also happens, as I told you, that etiology is based on the technology. So etiology keep changing for a particular disease. Particular disease, let it be X. Priorly, that was linked to something else. Later on, technology advanced. Now this X disease is linked to something else, because they have come to know and they say that yes, I have got. Later on, what I wanted to say, similarly, the medicines are also they are changing. Priorly, if you, I think that most of the physicians, homeopath physicians, might have understood that there were several medicines. Like recently, if recent, I want to remember, there was a tablet on ice, NISE, sir, NICE. NICE tablet was being given for the fever, and it was violently used among the society, and it was said to be the best medicine for the pyrexia or fever. But sooner or later on, it was stopped. It's what that it is making more harm. Then again, another medicine start, and nowadays a sumo. Now after sumo, it has stopped. Now it is a dolo. So they are they are introducing new medicines every 6 months or every 2 years. They're introducing for the same disease condition another medicine. Then they only say, though, no, that is not effective, that is very harmful, so you should use this one. So this is what happening in the other system or system of modern medicine on the basis of the pathology. But it never changed that now arsenic will not be used, belladonna is not will be used, sorinum or phosphorus will not be used. We have never told like that. Yes, what medicines produces naturally the sign and symptom 200 years, 300 years, 400 years ago, that is also today. One can see and test those things, investigate. So concept of pathology, now there is less time, so I need to discuss more. So I will go through fast. So pathology is scientific study, of course, of the disease, focusing over there, where pathology, what pathology find, the structural and functional causes, development, and visible, see the word here, visible cellular or tissue changes, not dynamic, visible changes. In many contexts, observed pathology considered as the footprint, the lingering structure of the physical evidence of the disease, active underlying molecular process. And similarly, the language of pathology through its representation, structural change. How? This is the exfoliation, there is some exfoliation, degeneration, understanding cyst, that is progress of the disease, and understanding TIS, that is the inflammation part, or abnormal feeling and sensation. So pathology is the product of the disease, not the disease itself, which is to be treated. That I have already told you. Now, the footprint concept in the medicine, there is some active pathology that is known as the they said that, yes, I have found the culprit. So that dynamic ongoing molecular biochemical process driving the disease, that is toxic soluble proteins, active inflammation, or genetic mutation. Similarly, the footprint that was I was telling you, that is the evidence. They say that the pathology is the footprint of the disease that is to be understood. The downstream morphological result of the disease process, such as tissue scarring, cell death, structural uh, aggregation, that is neurofibrillary, tangle, tumors, etc. So it is bacterial diseases. I have already told you that a severe airborne disease like lung disease, myobacterial tuberculosis for tuberculosis, and streptococcus, strep throat, that is highly contagious infection, as streptococcus bacteria, urinary tract infection, common bacterial infection. Likewise, that diseases from the viruses, like we have seen the COVID. I will not focus over those diseases, their treatment. They are focusing because it will take longer time. And like influenza, the virus responsible, chickenpox, singles, virus responsible, and diseases from the fungus, that is ringworm, athlete foot, common athlete skin, nail infection, yeast infection, histopathological and parasitical issues, and the concept of disease. Now, if there is some bacteria, virus, fungus, it is not like that, we do not consider. But as I told you, we consider the material, but not exact the material cause, but its dynamic effect, dynamic noxious effect of the body. So man, or who takes such disease condition, according to Kane, who has said that man is primarily sick before the invasion of the materialistic cause of the disease, that is bacteria, virus, fungus, parasite, etc. So, and according to aphorism number 31, organ of medicine, so man is made sick only when the conditions are favorable to get sick or get affected by the visible microorganism. Otherwise, the man is being surrounded by several bacteria virus, but those means are not being sick because the favorable condition is not known. Favorable host is to be provide a real atmosphere to grow that bacteria virus, and that influence will come only then when there is some situations in the body is there. At the same time, which what bacteria viruses are not affecting, now it is able to affect the person easily. Disease are conditional. Disease is a series of events. I have already told you. Disease are identified at a given point of sickness, and that is to be treated. A, from pathological point of view. In homeopathy, the current sickness is being linked with the past history and family history, and along with the along with the mental general, physical general, that is case taking. We understand a person as a whole. After individualization, we give the treatment. I'm not focusing over this phenomena right now. Acute disease type of acute, we understand all those things. So I'm just pointing out. We understand acute diseases, type of acute diseases. We understand chronic diseases, types of chronic diseases. We understand the concept of miasm and role of its diathesis. In homeopathic concept of susceptibility, what it plays role, how to man get sick. We understand concept of individualization, on which the patient is being treated, and the concept of modalities and concomitant, which help in the prescribing the medicine or identifying the suitable medicines for the patient, that we understand. Now, the infectious disease like bacteria, viruses, if etiology is not known, it is idiopathic. I've already told you lifestyle disorder diseases, and then the autoimmune disorder. Now, we need to understand one more thing from the pathology point of view, that there is some physiopathology or pathophysiology. So, pathology understand, pathology relate that yes, they have understood that this physiological function, this physiologic phenomena this harmonious changes, this blood chemistry or lymph, etc., whatsoever is there, here some disturbance has taken place. That is this pathology. Just see what changes has taken in the physiology that causes the pathological condition. Understood. Similarly, what pathology they are examining, and this pathology can affect this physiological function, vice versa. So yes, it is true, but they are unable to understand that this physiology changes why has happened prior to the pathology. So what is there, what was there, why they were something changes. So that is dynamic which we understand. And similarly, if some pathology is there, that what causes there some physiological changes, and that we understand that how pathological thing can affect the man as a whole, from the mental ability, from the mental thoughts, and how this physiology is being disturbed. So these phenomena is to be understood. So they are linking and trying to know what physiological changes were there due to this pathological condition is shown. Furthermore, it is still unknown the physiological condition was disturbed. Why the physiological condition was disturbed? So how to treat such diseases which are idiopathic or autoimmune diseases means when the etiology is not known, only through the steroids, corticosteroid and so on. So here the man is ignorant, patient is ignorant. So they need to understand differentiation, that what is palliation, what is suppression, and what is recovery and what is cure. So the most of the patient who goes to allopath treatment are unable to understand that there is disease is not cured, but that is palliated, and that is the suppressed. Likewise, that. So there are several conditions which I'm not going to discuss in the detail, but just I'm giving the point that these are the points which are to be thoughts which are to be understood. Therefore, when there is no etiology, homeopathy is the solution to treat such diseases on the basis of abnormal sign and symptom, which provide relief, improvement, and even cure. Similarly, some examples in the Hindi session, it was told that there should be some example. So I'm just giving that how pathological things can be treated through the homeopathy very easily. So a patient lady of 50 years was given advice for her knee pain that total knee replacement is to be required. And when she was treated through homeopathic after individualization, it was revealed through the symptom that the third patient was the patient of veratrum alb, and when veratrum alb 2 doses, only 30 potency was given. Her knee replacement was still not instituted even today after not 5 years. Now it has become 8 to 9 years. She is well. There are several cases of ignitia, I will tell you, that even in ignitia said that when there is no pathology, there is no pathological finding there, and even then the patient is sick, ignitia is the solution for such diseases. And I have treated several cases through the ignitia where there was no pathological condition, but the patient was sick. So I remember my cases. A 26 years girl came to our clinic, came to my clinic with thigh pain. So thigh was paining very, only say one right leg, right thigh was paining. And after investigation, no traces, MRI, CT scan, everything was done. No traces was found, her periods were, etc. Everything absolutely within the normal range. So here I thought to give Ignitia, and Ignitia 202 doses, one just now in the clinic and next in the following morning, recovered magically. And when she was being tortured for several years, 2 years, not several, 2 years, she was roaming from here to here to there, doctor to doctor, but she was never cured after having receiving several painkiller even. And another girl, 24 years, she was having respiratory distress, and she was from Pune. She came to the Patna hometown for 1 week. Her mother take her to my chamber and told that she's having lots of trouble due to respiratory. She's not eating well. She's not taking food even. So just see the doctor. So I wanted to investigate. When I told that I need to ask some question because I understood from my experience that what condition might have happened. Mother just indicated through her sign that she talks for the late night and she is crying all the time. So from that point, when I asked her mother to just give me 1 minute, I want to ask some personal question. She told that we are very much a religious family, so there is nothing else. So you can ask. Then I did not ask any question. I gave Ignitia, and within 4 days, she recovered. Then mother took her to my chamber and told that just doctor, she's here. Now you can ask anything. I am going outside. I told that now there's no need. So she was almost recovered from everything. So that way. And most of the doctors understand there are several pathological conditions which are being treated with the TUSA. So TUSA, several viral conditions are being treated and cured like verruca, warts, etc. So several such viral conditions are very easily treated through the homeopathic medicine without knowing true etiological condition, but those diseases are recovered very easily. A case I do remember for the Hycemus, I salute Hycemus, that the cough patient was coughing too much as soon as she lies on the bed. It is written in Materia Medica. That is why when I used it, Hycemus, only one dose, it recovered for 15 days of cough, which were very much torturous for her to sleep. So this isomas. So what is pathology here? What pathological? What X-ray? What in expectoration you can find in such cases, which homeopathy cure truly. Similarly, I have studied like also Bursa P that it can remove the catheter of long time. And I used it, mother tincture. In mother tincture, a lady was lying on the catheter for 2 years. But after giving several doses of medicine for several days, then catheter was completely removed, and still the patient is there, and she is under my treatment for another complication, that is paralysis. So such cases can be very easily understood and seen through the pathology point of view, that even pathological condition is after treating several diseases, but homeopathy is beyond pathology. It starts where the allopathy closes, and that is why the several stalwarts has also told us about this. We can understand, last time I have discussed UTI, hepatitis, since the time is less, so I will not discuss now these diseases. So one should know, we homeopath understand that if neuroendocrine system, that is the dynamicity in the neuroendocrine system, disturb neuroendocrine system, then there the symptoms appear and diseases appear. So we need to stable, that is harmonious in the homeostasis or neuroendocrine system. Only then the diseases are cured. So now I will stop my lecture
Yes.
because time is now over. So thank you very much for patient hearing. I do not know how many of you have understood and how many of you have gone through it.
Yes, sir.
So if there is any
Yes,
question,
sir.
then
Yes, sir. It's really
you
a
ask.
wonderful session, sir. As you rightly point out, the pathology, why one should study pathology and how the disease move into different size and how we can manage. All those things were discussed in a beautiful way. And as you suggested, we can have some more session about the other systems also, the neurological conditions and all those conditions also.
Thank you, sir. Thank you. If there
Let
is any
Since our
question,
time is over, I am
yes.
inviting uh, Dr. Ramarasa sir to say a vote of thanks to the session.
Thank you, sir. Thank you so much. You are always
Thank
there.
you, Dhaneji. Congratulations, Dr. Upendra Verma, sir. Very nice, excellent session.
Thank you, sir.
Concept of pathology and concept of homeopathy. The
Yes, sir.
main
Thank
cause
you.
of disease, according to homeopathic science, sora, psychotic, and syphilitic. And
Yes,
allopathic
sir.
science, viral bacteria, parasite. Ayurvedic science, bile, pit, cup. But homeopathic science is a dynamic science. Dynamic science, very dynamic. Cause of disease is invisible. Here, grief, fever,
Okay, sir. There is some network,
vital
so
force.
please.
ठीक sir. The vital force, homeopathic medicine is the dynamic. So three dynamic. So very science. Dr. Upendra Prasad Verma ji, thank you. Principal sir, thank you. Great presentation.
Thank you, sir.
Very good
Hi.
thanks. Thank you.
Thank you, Dr. Ambaresh, sir, and thank you, Dr. Upendra Kumar Verma, sir, and those who attend the English session. Tomorrow we will have a session from Dr. S. Bhuvaneshwari, and Doctor will be talking about don't rush to the flush, safe, gentle healing through homeopathy for toddlers, sebaceous. With that, we come to the end of the day at 2106. Thank you all. Good
Thank you,
night.
sir. Thank you. Thank you, sir.
Over to Dr. Manish tomorrow in the Malayalam session.